Good afternoon, Bermuda. Though we are a couple of weeks removed, it is my first opportunity to say that I hope everyone in Bermuda had a safe and enjoyable Cup Match holiday. It was a long-awaited celebration not only of our history and our culture, but of the progress that we have made as a country against the coronavirus. Such celebrations were not possible a year ago. However, with our strong testing regime, continually improving vaccination rate, and tools such as SafeKey, we've been able to see the return of Cup Match and other large outdoor events. Despite the continuing presence of the coronavirus here and around the world, it is important for us all to recognize that we are in a different place than we were a year ago, where the only measures to address increasing cases would be increasing public health restrictions. We now have vaccines, and 3 out of every 4 residents, or 75% of those who can get vaccinated, have chosen to do so. Our vaccination success means that more vulnerable persons in our community are shielded from serious illness or death, and means that we have been able to adjust our approach when we see cases increase. The entire purpose of public health measures was to ensure that our healthcare system did not become overwhelmed, as we've seen happen in many countries around the world. It was not to have no case of the virus locally, but to reduce the possibility that an outbreak would cause our hospital to exceed its capacity, which nearly happened in April due to the outbreak of the Alpha or UK variant. Due to the lessons learned, the government announced strong measures to protect Bermuda at our borders from dangerous variants such as the Delta variant. Unfortunately, before the full border policy could come into effect, this highly transmissible variant found its way onto our shores. And as a result of that, and some persons not adhering to health guidelines, we have recently seen cases increase. We are confident that these measures have been effective and will continue to be so as long as they are followed and as long as we continue to have the cooperation from the people of Bermuda. It is our collective responsibility as a country to ensure that all of us do what is necessary to reduce further local transmission and effectively manage this outbreak. Our success in increased vaccinations and in reducing local transmission cannot be met with complacency. We must keep our guard up and protect our healthcare system, protect those with medical conditions and children who cannot be vaccinated, and protect the ability of our students to return to school in September. I have no doubt that we will do this if we continue to work together. Tonight's press conference will be the final regularly scheduled press conference attended by the Minister of Health and myself together in this current format. Following tonight, regular COVID-19 updates will move to a technical briefing format with public officers from health and other relevant departments providing the public and their representatives in the media with essential technical details regarding the coronavirus. If there are major announcements and changes of policy made, they will be made by ministers, but standard updates will be given by technical officers in the future. Tonight, I am joined by Minister of Health, the Honorable Kim Wilson, who will provide an update on the latest coronavirus test results, vaccination certificate statistics, and other updates from her ministry. In light of our change of format for future updates to the public, we're also joined tonight by Ms. Daiwan DeRosa, epidemiologist in the government's Epidemiology and Surveillance Unit, who is on hand to answer any technical questions about the current cases that we may see right now by members of the media. The Minister of National Security, the Honorable Renee Ming, is with us and will speak on mandatory supervised quarantine operations, as well as any other matters from her ministry as we are in hurricane season. Additionally, the Commissioner of Police, Mr. Stephen Corbishley, is also with us tonight and will speak on matters regarding enforcement and take any related questions from the media. First tonight, we will hear from the Minister of Health on the latest matters surrounding the coronavirus. Minister?
Thank you, Premier. Good afternoon. The Ministry of Health received 4,927 test results since the last update, and 18 were positive for COVID-19. This gives us a positivity rate of 0.4%. These results are from testing done on the following dates: Monday, August 9th, 8 positive out of 2,354 results, which is a positivity rate of 0.3%. And on Tuesday, August 10th, 10 positive cases out of 2,573 results, which gives us a positivity rate of 0.4%. 2 of the new cases are classified as imported, and their details are as follows. One resident who arrived on JetBlue flight B6203 from Boston on the 5th of August and tested positive on their day 4 test, and one resident who arrived on American Airlines flight AA2044 from Charlotte on the 10th of August and tested positive on their arrival test. 12 of the new cases are classified as local transmission with known contacts, as they are associated with known cases. The additional 4 new cases are classified as under investigation. These cases are among residents with no currently identifiable link to either known cases or history of travel within the past 14 days. Additionally, since the last update, there were 9 recoveries and no deaths. There are currently 92 active cases, of which 89 are under public health monitoring and 3 are in hospital with 1 in intensive care. Since March 2020, Bermuda has recorded 2,663 total confirmed cases of COVID-19. Out of these, 2,538 persons have recovered, and sadly, there have been 33 COVID-related deaths. The source of all active cases is as follows. 34 are imported, 47 are classified as local transmission, of which 47 are local transmission with a known contact or source, and 0 are local transmission with an unknown contact or source, and 11 are under investigation. Of the active cases, by vaccination status, 42, which represents 46%, are fully vaccinated, and 50 or 54% are not vaccinated, including those not eligible for vaccination. By vaccination status and transmission, of the imported cases, 68% are fully vaccinated, and 32% are not vaccinated, and that includes those not eligible for vaccination. With respect to the local or under investigation cases, 33% are fully vaccinated, and 67% are not vaccinated, including those not eligible for vaccination. Of those active cases by variant type, none are alpha, none are beta, and 81 are delta. None are gamma or the wild type, and 10 are not able to be detected, and 1 is not available. The source of all our confirmed cases is as follows. 389 are imported, 2,243 are classified as local transmission, of which 1,748 are local transmission with a known contact or source, and 495 are local transmission with an unknown contact or source, and 13 are under investigation. And as we've stated previously, as investigations proceed, transmission categories may change. The 7-day average of our real-time reproduction number is less than 1, and Bermuda's current WHO country status remains at sporadic cases. I'd now like to provide an update on our vaccination program. We have completed 30 weeks of vaccinations. Since January 11th, Bermuda has administered a total of 83,543 vaccinations. Of the 83,543 vaccinations given as of the 7th of August, 52% are women and 48% are men. 82.7% of all residents over the age of 65 have had at least 1 vaccination, and 81.4% are fully immunized. To date, 65.7% of the population has been vaccinated with 1 dose, and 64.4% of the population has been immunized, namely having 2 doses. We have 5 active confirmed clusters, and this is concerning. We cannot afford another outbreak, and it is the impact that it will have with respect to our health and safety, our economy, and not to mention the stress that it will put on our entire healthcare system. As I have repeatedly stressed, the vaccine against COVID-19 is one of the single most important measures to keep our community safe. Vaccines prevent approximately 80% of symptomatic infections, and vaccines prevent approximately 96% of hospitalizations and deaths. Vaccines also appear to reduce transmission. As I've said earlier, Of Bermuda's 34 active imported cases, 68% are fully vaccinated and 32% are not vaccinated or eligible for vaccination. And of our 58 local transmission cases or cases under investigation with no known contact to travel, the situation is reversed. 33% are fully vaccinated and 69% are not vaccinated or eligible for vaccination. In other words, for local transmission, not surprisingly, the majority of persons who are positive are not vaccinated. There are more than 100 positive cases associated with this current outbreak. Current evidence suggests that there have been a handful of instances where a fully vaccinated person has transmitted the virus to someone else who is also fully vaccinated. Overwhelmingly, locally, people are getting the infection from unvaccinated people, or residents are getting the infection when they travel overseas. Currently, the government is not proposing further restrictions, but the situation is being closely monitored. This means everyone must take responsibility for their actions. No one wants to see a surge in coronavirus cases, and especially hospitalizations or deaths. I will continue to remind you that the Delta variant is highly transmissible, and it is critical that everyone, vaccinated or not, gets back to the basics. Wear a mask, practice good hand hygiene, and keep physically distanced from those not in your household. When you travel, you must be extremely vigilant. It is obvious that many residents are getting infected in other countries and then returning home. Fortunately, most travelers are fully vaccinated. Remember, mask wearing is just as important when you travel off the island as it is when you are here on the island. Businesses also need to get back to basics and ensure that adequate hand sanitizer is readily available and proper contact tracing is strictly maintained. I will remind the business community that this is not voluntary. It is a requirement, and enforcement action may be taken against your businesses that if you do not comply. I would now like to change focus for a moment and discuss the most recent amendments to the quarantine order, namely the Quarantine COVID-19 number 3 Amendment number 3 Order 2021. The First Amendment will establish border rules for cruise ship passengers arriving by sea. A cruise passenger is a person who intends to travel by sea to and be landed in Bermuda. A mariner, of course, on the other side, is a sailor, and so cruise passengers are identified separately from mariners. The requirements for cruise passengers are as follows. They must obtain a COVID-19 vaccination. They must COVID-19 PCR test result no more than 4 days before departure from their last port prior to arriving in Bermuda. They must apply for a travel authorization by completing the TA form of the government portal. And if a passenger arrives here unvaccinated, that person, similar to the mariners, must quarantine on board the ship as directed by the chief medical officer. The Second Amendment concerns 2 vaccines, the Sinovac and the Sinopharm, which will be added to the list of approved vaccines for travelers. Several travelers to Bermuda have only had access to these vaccines and as such are considered unvaccinated currently by Bermuda law. And it is not intended that these vaccines will be used in our local community during our immunization program. This is just for travelers. The Third Amendment in regarding the COVID order is relating to the ticketing regime for breaches of public health and quarantine measures and requirements. Breaches of the legislation will result in an on-the-spot fixed penalty ticket and a $500 fine, which must be paid within 28 days to avoid criminal prosecution. Examples of breaches for which a quarantine penalty ticket can be issued are as follows. Failure to comply with the public health supervision requirements for 14 days after your arrival to Bermuda. Failure to comply with the requirements to be COVID tested, or failure to use the electronic monitoring bracelet as directed. Examples for breaches under the public health penalty ticket are as follows. It can be issued to a person that's visiting a person who is in quarantine or isolation, a person who's hosting or assembling a group of people larger than the permitted group size without an exemption, or a person who is leaving a place of active monitoring, i.e. a place of quarantine after potential exposure to COVID-19. In terms of enforcement, health compliance officers are preparing files as we speak for the Bermuda Police Service and the Department of Public Prosecution regarding cases where people have left quarantine, provided false information as part of their travel authorization, or not followed the travel continuum. Additionally, environmental health officers are doing spot checks and for restaurants, bars, shops, and other public places to make sure hand sanitizer is available and proper contact tracing records are being kept. These are the areas where business operators have reduced their efforts, and penalty tickets can be issued in these situations as well. Finally, we encourage you to get tested and to know your status, and if eligible, speak to your physician, make an informed decision, and get vaccinated. It is important for persons to quarantine according to the quarantine rules, if you are required to do so, as it helps avoid putting others at risk of catching the virus and spreading it throughout the wider community. After exposure, it may take up to 14 days before an infection develops. Persons become infectious and can spread the virus to others 2 days before their symptoms start, and up to 7 days before their positive test results if a positive person does not have any symptoms. We are also urging people to please fully cooperate with the contact tracers. Our contact tracers continue to work tirelessly to protect Bermuda from the spread of the coronavirus. But some people in our community, when contacted by a contact tracer, are not cooperating. If you are contacted by a contact tracer, fully cooperate with them. This whole process is completely anonymous. They will protect your privacy. Your cooperation will protect the health and well-being of our wider community. We must remember that this pandemic is not over. Do your research and talk to your doctor and make an informed decision about getting the COVID-19 vaccine. There's a wealth of information about the vaccines online at the government.bm website. The COVID-19 pandemic has exposed the world in so many ways, including the unfortunate reality of the inequity, particularly as it relates to the provision of medical care. As we saw and continue to see, the COVID-19 virus has run rampant throughout the world, and access to quality health care is one of the most important ways to win the war against the virus. This pandemic has created a paradigm shift, which has exposed and shown us in very certain terms the consequences of inequitable access to basic healthcare services. The lessons have taught us that we must make more aggressive efforts to bridge the inequality gap. Benefits such as access to prescription drugs and ensuring that every person has a fair start to basic health care from birth are fundamental needs, both for everyday living and during times of world crises such as this pandemic. Therefore, Bermuda, we must strike the new path for our health system. We have heard this clearly from our discussions with patients and stakeholders across the health system in recent months. Moving forward, it is vital that patients are placed front and center in the health system, a system that needs to work better for them, but are also better for Bermuda. And this is this government's commitment to Bermuda. To deliver this, we have brought together stakeholders and patient representatives from across the health system to work together in developing a new roadmap for strengthened healthcare delivery, and all of this is in support of the government's objective to provide universal health coverage. In closing, each of us has a role to play in stopping the spread of the coronavirus. Follow public health guidelines, wear your mask, practice good hand hygiene, maintain physical distancing, and download the We Health Bermuda app. And never forget to avoid the 3 C's: closed spaces, crowded places, and close contact settings. Because our safety and our health is in our hands, and it's dependent and upon each and every one of us to be committed to ensuring that we do our best to mitigate against further spread of the coronavirus. Thank you.
Thank you, Minister of Health. And thank you to your entire team at the ministry for their continued hard work in helping Bermuda battle back against the coronavirus. We should continue to be proud of our country's response to this pandemic, in that we maintain one of the most sound and stringent testing regimes in the world, which allows us to be informed and aware of our status as a country each and every day, recently surpassing over 400,000 tests conducted. Testing capacity remains available. I encourage persons to utilize it, get tested, and to know your coronavirus status. It is welcome news to hear that us as a country have now 3/4 of the eligible population vaccinated. Vaccines remain available to anyone who wishes to get them, And as always, I encourage you to speak to your doctor so you can make the best and safest decision for yourself. Along with our testing regime and vaccinations, we must not abandon the basics which have helped keep us safe from the beginning of the pandemic. And I join the minister in reminding everyone of the importance of hand washing, sanitizing, mask wearing, especially in groups where you're unsure of a person's vaccination status. We must also continue to use technology to assist us. SafeKey is a valuable tool that will permit businesses to continue to operate while reducing the risk of coronavirus spread while indoors. I remind the public that you can receive a SafeKey through the receipt of a negative coronavirus test with the expiry date provided on your SafeKey. Those who are fully vaccinated and whose vaccine-based SafeKeys have expired or will expire on the 15th of August can renew their SafeKeys by going to gov.bm/SafeKey and clicking on the link at the top of the page which says click here to renew. In addition to SafeKey, I encourage the public to continue to use the WeHealth app to help our contact tracers to protect your businesses and others. While we have seen a recent increase of cases in our community, this does not mean that progress has stopped. A year ago, before we had the vaccine, these numbers may have meant strong restrictions and left us with a feeling of having to start over. However, our increased community protection due to 3/4 of the eligible population being vaccinated means that while we must remain cautious and protect those who are not eligible, such as young children, we can also continue to allow economic and cultural activity to continue with precautions. Switching now to supervised quarantine. July 23rd, the Supreme Court announced that the government was successful in its defense of the legality of this government's supervised quarantine regime. The court dismissed all claims by the applicants and determined that the government's policy is lawful and not a breach of Section 11 of the Bermuda Constitution. We often confer on peaceful protests the description of democracy in action. That is an accurate description, but it bears remembering that another cornerstone of democratic societies is the rule of law and the ability of ordinary citizens to seek justice in the courts. In this case, citizens of this island exercise that democratic right, and in a fair, transparent review of the evidence, the court has made a determination. Whilst the applicants may not have been successful, it is without question democracy and our democratic principles that emerge as the victors. The government's case met the required tests, and the evidence provided in support of the actions taken to keep this country safe has satisfied the Supreme Court of Bermuda of its foundation in Bermuda law and the Bermuda Constitution. As I indicated in the House of Assembly on that day, the government will announce changes to the approach to supervised quarantine. Thanks to our progress in having nearly 75% of the eligible populated vaccinated and increasing the protection within our community, we can now begin to make revisions to how supervised quarantine works for unvaccinated persons who come through our borders, allowing a portion of their 14-day quarantine to be completed at home with strict restrictions. Effective from Monday, August 23rd, supervised quarantine will operate as follows. Unvaccinated travelers with a valid pre-arrival test will still be required to quarantine for 14 days upon arrival in Bermuda. They will quarantine for their first days at a designated hotel facility. Following the receipt of a negative day 4 test, they will then be allowed to complete the final days of their quarantine at home, fitted with an electronic monitoring device. Those persons will test on days 4 and day 14. Additionally, if the traveler in question, who is allowed to quarantine at home following a day 4 negative test, does not live alone, all members of that household will be required to quarantine as well and must test out of quarantine on day 14. Unvaccinated traveler without a valid pre-arrival test will be required to quarantine for 14 days. They will spend the first portion of their quarantine in a designated hotel facility. Following the receipt of a negative day 8 test, they will be allowed to complete the final days of their quarantine at home, fitted with an electronic monitoring device. These persons will test on days 8 and day 14. If they do not live alone, all other members of the household will be required to quarantine as well, and all members of the household must test out of quarantine on day 14. These changes will take effect on August 23rd and are being made due to the incredible progress that the country has made in its vaccination program. These changes are not required, but looking at what we are seeing, we believe that these changes and adjustments can be made. I now invite the Minister of National Security to provide an update to the country on the current supervised quarantine hotel operation, and certainly with other matters from her ministry. Minister Ming.
Good evening, Bermuda. I want to begin my remarks by thanking all of our enforcement and emergency agencies for their tireless work over the Cop Match holiday. The holiday weekend, thankfully, did not see any significant disturbances, road traffic incidents, or infringements of the COVID-19 regulations. And for that, we should all be grateful. I will now provide a brief update on the government-supervised quarantine facilities. There have been 228 persons who have been released from quarantine, and currently there are 56 in our facilities. These measures are in place at our borders to mitigate any further spread of the dangerous coronavirus. The changes to the unvaccinated travelers' requirements to stay at a quarantine facility will be a welcome change to many, and the requirements will continue to be reviewed as we respond to the COVID-19 threat. Prior to quarantine, to follow the quarantine rules to protect the community from the spread of the coronavirus. Remember, Bermuda, this pandemic is not over, and we must all remain vigilant and take responsibility for our safety. Everyone must do their part to stop the spread of the virus in Bermuda. Before I close, I'd like to take this opportunity to remind everyone that we are in hurricane season, and this season is predicted to be above average for hurricanes. I urge all residents to either be prepared or get prepared now. Prepare and repair your house for hurricane season. Carefully review your family plans and update them with any changes to phone numbers and other important information. Take stock of all medical prescriptions that your family and pets require and ensure you have at least 2 weeks' supply on hand. Check your hurricane kit to make sure you have working flashlights, a portable radio with spare batteries, and a stock of non-perishable food to last your family for 7 days. Ensure your house insurance policy is up to date. Important. Check with your vulnerable neighbors and ask them if they need any help with their preparations and keeping COVID-19 safety precautions in mind, of course. Every year during hurricane season, Bermuda demonstrates its strength and resilience. As I've said before, I'm confident that this year will be no different, and we will safely weather any storms that may test our shores with proper preparation. Thank you.
Thank you very much, Minister, and thank you to your team at Ministry of National Security. You've done an admirable job in managing the important operation of supervised quarantine. And as it does transition to a mix of supervised quarantine and home quarantine, I'm sure that you will continue to do that. We will now hear from the Commissioner of the Bermuda Police Service on enforcement matters. Commissioner.
Ladies and gentlemen, in support of obviously the government and the Ministry of Health's continued agenda to protect Bermuda, the Bermuda Police Service will be concentrating on compliance within bars and restaurants from this point ongoing. And whilst we have paid attention to this area, there will be a step up in the amount of attention that we're going to take forward from this weekend. We know that the virus causes most vulnerability in enclosed spaces where physical distancing is not observed. And we also know that there have been cases where that has taken place within licensed premises. We must be clear that the rules are there to be observed. Employees within a bar and restaurant must wear masks at all time. If you enter such a premises as a patron, you wear a mask going in and you wear a mask going out, and at all times moving around a restaurant or bar. The only time a mask should not be worn is when you're sat at a table eating. There is a section in the regulations that allows you to stand at a bar without a mask, and this is a concern for us. And one of the things that we will be doing with licensees is to encourage physical distancing for those that do choose to stand at a bar. And we hope we will be able to work with them and encourage people where seating is available, that patrons are encouraged to sit down. This is about us collectively working together, and we look to support from the licensing sector to work with the police. But let's be clear that if breaches are found, then they will be actioned against. And that may include the proprietors and it may include the patrons within. And we've continued to work with the public in this regard, giving information. But it's absolutely clear that we need to maintain the direction that Bermuda has travelled to protect the island and to ensure that we don't see spikes in regards to the virus being spread in certain locations. And that operation will begin this weekend. And I'm grateful to government to their support that's assisted us with resources to be able to carry out this activity.
Thank you, Commissioner, and thank you to the Bermuda Police Service for their continued cooperation in working alongside the government throughout the pandemic. It is vital that all persons do their part to mitigate the spread of the Delta variant. Indoor spaces where masks are not worn are the most likely settings for there to be super spreader events, and the government fully supports Bermuda Police Service in this enforcement effort. As we bring the remarks to a close and open it up for the media for questions, I remind you that this will be the final regularly scheduled COVID-19 press conference, and that we'll be switching to a new, more technical format for updates going forward, which will not include myself or the Minister of Health on a regular basis. Further information will follow on how the public will be kept up to date on the coronavirus in due course. The government recognizes, as all ministers have said, and also the Commissioner of Police, that the pandemic is not over. But we are proud of what we have been able to accomplish as a country. And by the way, we are making the theme of the national address, moving beyond the pandemic, a reality through our unity and perseverance. The government is proud to have provided over $70 million in unemployment assistance overall, including $9 million since December 2020, to help those affected by business closures and restrictions through our most difficult times as a country. The commitment to ensuring the needs of Bermudians are met does not end here. We will continue to work not only on effectively managing the impact of the coronavirus on our island, but on seeing through our plan for economic recovery and the continued reignition of our tourism industry. I thank the Minister of Health, who has been with me at these press conferences since the very beginning of the pandemic. I wish to thank the Minister of National Security, who has been joining in since last year. And I wish to thank each and every one of you for your attention during these press conferences, and to the members of the media for their questions, for your support, constructive criticism, and concern for the hard work that you have done as residents for helping us to move beyond the pandemic. I thank you very much. And now look forward to taking questions from members of the media this evening.
Premier, we'll start with Bermuda Broadcasting.
Good evening. The Health Minister, there are many parents and children who are returning to the island in the coming days. School starts in a few weeks. What procedures will be in place for the safe return to school? And will students and teachers be provided with self-administered rapid tests so they can feel safe going back to the classroom?
Thank you, John. The processes as it relates to public health safety and the recommendations for the return to school have been provided to the Minister of Education. In fact, recently he indicated that he and his team will be meeting next week so that they can go through those processes and revert back to the ministry if there's any questions, et cetera. And then from there, they will communicate that to the teachers and the parents in real time prior to the commencement of school. So he'll probably be able to add a little bit more detail to that, but Health has been working with the Ministry of Education to provide them with the parameters that we request for safe return to school for both the staff and the students, because clearly our objective is to make sure that the students and the staff are safe and that the students have an opportunity to learn within the buildings as opposed to remotely.
Okay. As a supplemental to, sorry, as a supplemental to that, can you say that there will be some changes then?
I don't have the actual policies, proposed protocols in front of me right now. I've reviewed them a couple weeks ago, so I can't speak to that. However, I would anticipate that the Minister of Education will be providing the public with details as to what is going to be required with respect to safe return to school. Because again, that is obviously our ultimate objective.
If I may just add, Don, and the Minister of Health has covered most items. The government, as I've indicated inside of my statement, I think the Minister of Health included in her statement, our primary concern is making sure that we protect the return to school. We recognize the damage to students if they are not in school, the difficulty it causes to parents. And so our work is certainly going to be to make sure that happens. The Minister of Education, as Minister of Health said, is seized, and it's likely that he'll be speaking to those matters next week or the week after, but you're welcome to address it. I'm sure you'll have a full press conference on there. I don't believe there's going to be changes. Our regulations are rather strict. We do have testing throughout all of our schools. So I think that's something that will certainly, without question, continue.
Okay, thank you. Number two, with regard to the clusters, what sort of details can you give to the public as to how they started or maybe how large they are?
Okay, thank you for asking that, because I actually was hoping that could be asked, because my statement was 17 pages long, so I didn't want to add to it. So thank you for asking that question. As I said, we do have 5 clusters, and one of the largest clusters is approximately 25 persons. And the circumstances surrounding that particular cluster, we've spoken about certain circumstances where individuals have not necessarily adhered to the protocols as it relates to return to work or return to travel. And needless to say, a compliance officer has been hired by the Ministry of Health, who is a former police officer, and he is assisting with the assistance of the Bermuda Police Service of putting together a file to address some breaches that have recently occurred that have caused this particular cluster.
Okay, thank you. Number 3, Mr. Premier, tonight you announced changes to the hotel quarantine policy using electronic monitoring devices after 4 days and a negative test. Why weren't electronic monitoring devices used before instead of hotel quarantine?
Electronic monitoring devices were used before. It was our judgment and our view that we wanted to protect the country from the entry of new dangerous variants until we got to a place where at a relative level of community protection through vaccination. That was a strategy that was set out by the government of Bermuda in April in the national address of which I gave, and that was the strategy in which we executed. And we managed to make ourselves to a place where we've got up to 65% of the total population and 75% of the eligible population. Our goal as a country was to make sure that we reduce the possibility of the overwhelming of the healthcare system. And the judgment that we made at the time in April was that this would be the most effective method in which to do so. Now that we're at a place of 65% vaccination, which we did not know that we would reach when those things were announced. You have to remember, the government made a very massive push to try to get us to a place where we did that. We even had vaccines that we were able to give to other countries, as we were not able to use them all. So I think it's important to recognize that the announcements were made at that point in time. There may have been change that could have been announced prior to the court case, but they could not happen because the court case was taking place. We look at the situations, we adjust to the situations which are based on the ground, and now we're at the point where we're at 65% of the total population being vaccinated and 75% of the eligible population being vaccinated, that we can go ahead and make some of these changes. But you must recall and must understand that there will be still a mandatory period of supervised quarantine for those persons. People with a pretest, a valid negative pretest, will be able to do it for 4 days. That means it'll probably be about 8 days, which will capture most of the risk. And those persons will be able to complete the rest of their period at home. And people without a pretest will be in a hotel facility for 8 days. They'll be able to complete, or at least 8 days, depending on the time of the testing, and will be able to go after receipt of their day 8 tests. So these are judged as prudent, and they're judged insofar as the value of making sure that we continue to keep strong protections at our borders while making sure that we reduce the risk of overwhelming the healthcare system. We do not believe that everyone quarantining at home would be a good idea, and that is the reason why that is not what we're announcing.
Okay, thank you. My fourth question. The testing center at the Pro Post Office seems to swing wildly from having long lines with people waiting more than an hour to no lines and people just being able to walk right in and getting tested. Why is there such a variance?
The Perot Post Office, testing facility is the traveler's testing facility. And the variance can be attributable to two things. One, obviously, it depends on the volume of persons that have traveled into the island. Two, we stagger the time, so everyone is provided with a prescribed time when they are to test. Unfortunately, some people don't adhere to that, and they may, for whatever reason, decide I'm going to go in the morning, notwithstanding the fact that my time for myself and my 3 children is at 4:00 in the afternoon. That obviously creates a bottleneck because the provision of the services with respect to the testing is all based on how many persons and how many people can be tested in a defined period. So if people don't go when they're scheduled to go, then we're going to have a bottleneck. However, one of the things that we did add from Monday, particularly as it relates to the testing of individuals that are travelers that are staying at the hotels, we commenced our pilot on Monday at the Hamilton Princess and are testing all of the guests there at the Hamilton Princess and I think Rosewood and the facilities in that surrounding area. And we'll be rolling that out to other areas of the island as well, so that testing for hotel guests will take place at the properties, which will eliminate some of the strain that's currently on the Perot Post Office, because that is the one where all of the travelers test.
Okay, thank you. If you can indulge me for fifth question, since it's the last press conference. Well, that was a supplemental.
No more questions.
Okay, thank you. All right.
Adirondac's being nice, so I guess we'll be nice as well. Go on, Don Burgess. With that St. George's mask of yours.
It's a whale. But the minister,
I told her I wouldn't talk about our team today. Go ahead, Don.
Okay. Was it in Bermuda's best interest to have busloads of unvaccinated foreign visitors, i.e. the crew from the Viking cruise line, entering our only hospital to get the vaccine? Why didn't we use like a mobile vaccine center like we're going to do for the hotels, and we've done elsewhere?
Yes,
I'm sorry, you have to. I'm not familiar with that. You said busloads of unvaccinated. Say that again.
Yeah, the crew from the Viking
went to get
the vaccine at the hospital. Why didn't we use a mobile vaccine center for them rather than taking them into the hospital?
Well, I suspect, and I'm certain that the hospital would have utilized their PPE and their processes as it relates to persons that are getting vaccinated. Everybody that would have went to the hospital would have been unvaccinated. So I suspect the processes that the hospital used to make sure that they're adhering to proper physical distancing and PPE use, et cetera, would have been applicable to people getting off of a bus from Viking or people that are within our community that are being immunized.
Okay, thank you.
Premier, Media Maya.
Good evening, everyone. Maya Palacio for Media Maya. My first question, I believe, will go to Minister Wilson. Of those who are unvaccinated and have COVID, how many got it from a close contact with a vaccinated person?
You're standing right in front of the technical officer, which she'll be able to turn around and answer your question. I think you have to come around there.
Good evening. As the minister mentioned in her statement, there has been a handful of cases where persons have gotten the virus from persons who are vaccinated. So at our current evidence states that about 5 or 6 persons have gotten it from someone who's been vaccinated.
And that's out of the current active cases right now?
Yes.
Out of the 92? Thank you very much.
If I may, could you possibly provide context on what those situations are, like household, et cetera, where people are there for a long time, sleeping in the same room with each other?
Pretty much, yes. Like in those situations, it kind of been a vaccinated traveler, but it's generally all household or very close conditions. They're close contacts.
Okay. Thank you very much.
I'm sorry.
You said it for me.
I'm just making sure because people will interpret it as someone walking across
Yes,
in the street.
very
and all the
close
rest. If you're
contact with
sleeping
these-
in the same
with
bed
these
and not breathing the same air.
That's enough.
My next question is
kissing each other.
for possibly Minister Ming or the Commissioner. It's about the electronical bracelets that will be used for those who are unvaccinated and have to do the quarantine at home. My question is, what happens when we run out or there is not enough bracelets, and how many do we have on Ireland to utilize for this purpose? Assuming that now that the protocols have changed, it's probably going to be a lot more of unvaccinated persons traveling.
I will just say that I'm not entirely certain that that is the case. I'm not sure that assumption is correct, but it may be. But I know that we have plenty of bracelets.
We do, and actually we'll be able to resource more as need be. So that's not going to be an issue insofar as lack of electronic monitoring devices.
Can you tell us how many we have right now on hand?
I don't know. I want to say a couple hundred, but I'm not 100% sure, but certainly sufficient. You would have heard Minister Ming say that there's 52 people currently, thereabouts, that are in the quarantine facility. So we wouldn't anticipate that those numbers would greatly increase, notwithstanding the provisions and the amendments that the Premier announced that will be coming to effect on the 23rd of August. Having said that, we will ensure that we have sufficient supplies so that those individuals that are quarantining at home in those circumstances will be fitted with the requisite monitoring devices. And removal of same is an offense.
Thank you very much.
Mhm.
Oh, can you actually tell me what the offense is for the removal while we're here?
It is under the Act and the improper, it's under the Fixed Penalty Act that I just spoke about, and the removal, failure to comply with the requirement to wear, oh, sorry. I think it's a $500 fine.
I did hear you say that, Dawn.
Beg your pardon?
I did hear the $500 Dawn.
Okay.
My next question is about the persons who will be, I guess, use of a better word, but replacing you, the minister and the premier for the conferences, the technical officers you said. Can you tell us exactly who those persons are, I'm assuming, and the specialties as to, taking over your position and why you decided to step down?
I'm absolutely happy to say that. I mean, moving beyond the pandemic means that we have to move beyond the pandemic and start talking about other things as well. The fact is that as we are moving into a phase where the government is making sure that we manage the pandemic here on island, recognizing with our high levels of vaccination, we may see some spikes, as we see in this particular case and instance, with local transmission, specifically on island amongst unvaccinated persons. There will be spikes. But for the most part, we need to, as a country, move beyond the pandemic. What I also think is important is that I know that a number of members of the media have a number of questions they want to ask. And I think that a technical briefing will allow persons to dig into the actual issues of coronavirus specific matters when they're asking, how many clusters, what about this, all those particular things, which I don't believe are best served in this environment where, you might get 4 questions every 2 weeks. So I think it makes more sense, will allow more information about the coronavirus to actually be done, to be examined, and the members of the media will not have to, get upset that they are not getting enough information when it comes to the actual issue, which these press conferences about, which is the coronavirus.
Will the number of questions be extended for journalists then? more than
I'm
4?
certain there'll be sufficient time and capacity. So as I said, we're going to lay it out, but it's not going to be in a format like this. We're going to make sure that members of the media will be able to interact with technical officers and be able to put questions in advance and be able to get those particular technical things done by the people who are working with this stuff every day. The Minister of Health gets a briefing, I get a briefing, but these are the persons who are dealing with it every day.
And my final question was, out of the 5 active confirmed clusters, can you tell us the names of those clusters and how they came or no?
I'm not in a position to disclose the particular details, but as I indicated previously, one of the clusters has about 25, the second one has about 10, another has 8, and another has 9. But more details will be revealed in updated court proceedings.
Thank you very much.
Mhm.
Premier, we now have the Royal Gazette.
Owen Johnson Barnes with the Royal Gazette. Given the high prevalence of the highly contagious Delta variant in Bermuda and the fact we're still short of community immunity, is the government reconsidering exemptions for large gatherings and the restrictions that are related to them?
As the Minister of Health says at this point in time, no, we are not considering changes to the restrictions that are in place. As we've noted that there are specific clusters which are there which we understand we have very high testing capacity. I think that large events where safe key and persons who may not be vaccinated are required to get tested, we've caught some cases there as well. So I think that's something that is certainly beneficial. But as we've said, we want to support economic activity and cultural activity and those things to continue. And so from that perspective, as long as the enforcement action is taking place, the Ministry of Youth, Culture, and Sport is making sure they are working with the Ministry of National Security, the Bermuda Police Service, that all large group exemptions that are given will have enforcement, that people can make sure that persons are following and abiding by the rules of that. You've heard the police commissioner speak about liquor license establishments where there are people without masks who may be gathered, to make sure that the rules are being followed inside of those places. And that's what we have to do. The fact is that the coronavirus may be with us for a while, and we're going to have to learn how we deal with the coronavirus being with us for a while. And that is the approach which the government has taken. The restrictions that were put in place were to ensure that the healthcare system did not become overwhelmed. In April, as Dr. Miller could very clearly state, where our vaccination rates were probably only fully vaccinated, probably about 20%, whereas right now we're at 65%. We were a few days away from the hospital being full. And we've seen what happens when your hospital becomes full. People don't get access to oxygen, and they basically perish from the disease caused by the coronavirus due to lack of access. That is what we're guarding against, and we are going to make sure our policies are balanced in that regard. That doesn't mean that we're approaching a policy of it's laissez-faire. That's not what it is. We need to stick to basics. Hand sanitizer, wash your hands, keep your distance, and wearing your mask when you are in close proximity and indoors. That's important to do.
Now, of course, over the Cup Match holiday, there were a lot of events, many which were safe key, and many unofficial events, of course, which were not safe key. Things like non-Mariners and the non-Beach Fest, I suppose you would call it. Can you tell me what's being done to sort of police those, to regulate those and prevent those from becoming super spreader events? Obviously, when you have something like the non-Beach Fest and so many people gather together, if cases pop up, it's going to be impossible to community to track down where those cases came from.
Any thoughts?
Owen, you'll have more experience than I, that things like non-Mariners Day is very, very difficult to prevent. And obviously, we work in partnership with the Royal Bermuda Regiment and the Coast Guard to monitor safety. There are perhaps advantages with events that take place outdoors. We saw a couple of events, as you rightly say, suddenly emerge with beach festivals, but we provided adequate resources to attend those, primarily to deal with some of the issues of risks of antisocial behaviour, but also to look at some of those COVID aspects. As we do with any significant weekend, and Cup Match is probably the most significant of the year, we go into a review looking at the lessons learned. But in actual fact, I applaud colleagues in the police and our partners right the way across, because I think we dealt with the weekend very safely. And whilst we had some small incidents that we'll review and we'll take forward, I think the general message was that there was compliance across the island by many members of the public and businesses, and the message is quite clearly there. But on occasions where non-compliance didn't take place, and the minister's already highlighted that files will be prepared and those people will be held to account.
All right. Next, we have a question from one of our readers. Are people who are testing positive on arrival and are immunized being put into supervised mandatory quarantine? And if not, why not?
Okay, sorry. They're immunized, testing positive.
So if you fly to the island having been vaccinated, you test positive on arrival, are you being required to go to a hotel, or are you allowed to go home? And if they're allowed to go home, why is that person required to go home while someone who is unvaccinated and testing negative required to go to a hotel?
That person is permitted to go home, and they will isolate in their home. And as we've spoken about previously, there is a difference with respect to transmissibility of a person that's immunized versus a person that's not immunized, which is the impetus behind the position that the government took prior to, well, I guess April, whatever date it was. That was when we made the amendments to the legislation requiring mandatory hotel quarantine.
And if I may add, because I know this question comes up all the time, it is an incorrect moniker to say they are allowed to go home. You don't get tested at the airport, get your test results in 5 seconds, and then get sent here or get sent there. That's not the way it works. Everyone who enters the country is required to quarantine until their negative arrival test results if they're vaccinated. If you test positive, you do increase a risk if you are then going to try to get somewhere to move someone. So it is not correct to say they are allowed to go home. When someone tests positive, they remain where they are.
All right, and final question. We're going into this new format, and I understand the value of being able to question the technical officers, but are the technical officers going to be able to respond to issues of policy the same way yourself or the Minister of Health would? A lot of these questions that we're making in these conferences are not directly about statistics and figures. A lot of them are about how government is approaching these issues.
Obviously, I'm sorry.
Go ahead.
Clearly, questions of policy will be appropriately addressed to the respective minister, but questions of a technical nature obviously need to be presented to the technical. If I can be so blunt, oftentimes we're sitting here and I'm asked questions of technical nature that I can't answer and I should not be expected to answer. But then when we have the technical officers here, there's no questions. So our hope is that by shifting this, when the technical officers are present, you can ask all of the questions that you have relating to technical issues. However, obviously issues of policy, they won't be able to answer those, and those should be directed accordingly to the respective ministers.
I think part of our issue is that we have these 4 questions, and many of these were sent to you guys on Tuesday, and the answers were not came up in the statement. So if we're not getting these answers via email, and we're not having the live camera opportunities to speak to you, are we going to get those answers?
Well, allow me, as the minister who is responsible for communication to the government, we will do our level best to make sure that we provide the answers that we can. And the fact is that I know that it is difficult to understand for members of the media who are just chomping at the bit. But one of the things that I've realized in managing a country and governing a country through a pandemic, public officers, nor politicians, nor, I guess, humans, we aren't robots. People actually go on vacation. People actually need rest. And I know that all members of the media want the answers today, but you have to understand, World Gazette is one. There are numerous media organizations. Sometimes when I see the media queries that go into the Department of Communications, there's 20 separate media queries a day, multiple communications officers and people doing their jobs. And so the fact is, I know there is a propensity for media to write stories. I get that part, but we are doing our best to make sure that we can get the information. It is our view and our belief that technical briefings will be more appropriate and will allow persons to pose multiple questions of a technical nature so they can better understand what is taking place with the coronavirus here on island as we transition.
Thank you very much.
Premier, we'll now have TNN.
Good evening.
Evening.
Premier Brett, is the government considering mandatory vaccinations in certain circumstances in key area of government or the administration? And or if our COVID numbers continue to rise, do we foresee educators facing mandatory vaccinations?
The policy of the government in regards to vaccinations has not changed and has remained consistent since the beginning.
There's been no discussion.
The policy towards vaccinations has not changed. There has not been a view, discussion, an official position, anything which is taken. There are many suggestions which many people may make. People may look at what people are doing in other countries, etc. Our position has been clear from the beginning. At this point in time, as we have always maintained, when we are dealing with something, which we have right now, what have we said? The Minister of Health said, talk to your doctor. I said, talk to your doctor. Our ads say, talk to a doctor. The pre-roll in there said, talk to your doctor. Talk to your doctor. That is what we are encouraging all persons to do. I saw people at Western counties this weekend, and they're asking me, I said, what did your doctor say? They said, my doctor told me to get it. I was like, listen to your doctor.
I'm glad you did mention, yes, and with other countries around the world changing their protocols. And I was just wondering if there's been any discussion, but thanks for answering. With the change of the mandatory quarantine about to take place, Premier, or if you can answer, what is the total amount the government has paid out to hotel quarantine facilities since since the mandatory government quarantine process has been implemented? Do you have figures on, because there's been quite a few people that just didn't pay and that was left, the government had to foot the bill. What's the total?
Good afternoon. What has been paid to date, and that would be for invoices received, is actually a total of $222,561.85.
Banker spot. Okay.
Premier Burt, do you believe that the public has a right to know when or if a public leader is unable to fulfill his or her duties because of medical reasons? In every other jurisdiction, major jurisdiction, the government issues a release before the media stumbles onto the information.
The answer to your question is no.
And do we get an extra question tonight? This is the last one. Or is it Tina and stock to 4?
That's the question.
That's a fair. I was asking at Aramco. Thank you very much. Premier, there seems to be an increased concern in the community over what may feel is a lack of transparency in the Burt government. This was highlighted recently by the Auditor General, who was highly critical of your government. Do you agree or disagree with the Auditor General?
I will say that the Auditor General has a role to play inside of our democracy, and the government has a role to play inside of our democracy. I know that the Auditor General may have commented on out-of-date audits, but the audits have gotten better under this government. Talked about the issues when it came to the National Sports Center, with audits going back from 2012 from the former government, and now we're cleaning those things up. So the fact is the Auditor General has a role to play, but I think if you compare the outstanding audits and how that number has been able to continue to go down and the work which is taking place, I think that you would see that there's improvement. And so the Auditor General can say that there are outstanding audits, but I guess what the Minister of Finance, when he comes back, will be able to report how many of those outstanding audits are actually with the Auditor General's office themselves. The fact is that the Minister of Finance has done an admirable job working with limited and strained resources to ensure multiple departments have done a great job of getting audits up to date. When we came, as I said, in numerous occasions, BLDC, another example, where audits were not completed since 2012. So that is the view and position of the Auditor General. The Auditor General has a role to play in our country. The Auditor General has a role underneath our Constitution, and that role is to be respected. But I think that all things require proper context. And though it's very easy to report on a headline, I think what is also important to recognize is the trend, whether or not things are getting better or whether or not things are getting worse. The Minister of Finance is committed. He's said it in numerous cases to reduce the amount of outstanding audits. And we've seen in a number of places where there are long outstanding audits, those audits are being brought up to date. But also in places where there are the likelihood for outstanding audits, like you'll see in organizations that in some cases don't function that well, in parish councils, the government is certainly engaged in reform to make sure that we can get ourselves to a place where we do not have those particular challenges. So I would say that there is certainly progress, but I would challenge the Auditor General to state that there is anything that is going on that is untoward, because there's a difference between having a completed and sign-off audit process versus accounting that is not actually taking place. And with the upgrades that have been made by the Progressive Labor Party over the years, whether through Patty, whether it be through Ombudsman, or whether it be through the Department of Internal Audit, to ensure that we are checking ourselves before the Auditor General checks us, I think that you'll find that in good stead. And I think that it's very important for all persons to know that we have some of the most strong and stringent anti-corruption legislation on the planet. And I promise you that the Bermuda Police Service would not hesitate to act on any person inside of this government who they found was being untoward. So I reject the categorizations that are stated, and I think that everything must be placed in its proper context.
Appreciate that. I'm giving one more. I got to flip a coin on the question I'm going to ask. I know I should have asked this the last time the commissioner was here as an updated question. I've asked you, Premier, on time and time before. So since you mentioned the commissioner, I need to ask you a question reference to the investigation to $8,000. Can we get an update on that?
Trevor, the update is it continues to be investigated. There's been matters reported in the media. I think it's appropriate to say an investigation is a search for the truth. It's not to say that there's blame. I'm grateful to government support who have been transparent with the origins of this loan. There have been a number of parties spoken to. I am updated on it, and to echo the point of the Premier, the BPS obviously will focus on complaints of wrongdoing, and this is a complaint. But at this stage, there is nothing to update. But if matters are presented either to the DPP or even if the investigation is ended, then we'll make an announcement in that regard. So I'm not being vague, but obviously I'm just saying that the investigation is ongoing.
Supplementary, when do you think this will be concluded?
I'm not going to answer that, Trevor, because investigations go the direction that they go. Certainly it's one that is not simple. It's one that involves a party overseas. So there are inquiries to be done through that, and there's obviously inquiries to be done financially. And again, echoing a positive aspect, Bermuda has very strong financial controls, whether it be through the BMA legislation that we have. So we can readily identify certain issues that are supportive of investigations, and it's one where we're engaging with a number of different partners. But to answer your question about when we'll have an answer, we have to work expeditiously, of course, when it affects parties that are being interviewed, but I'm not going to commit to a date when we have to make a decision.
Premier, there are no more questions.
Thank you very much. Dr. Miller, you got off easy again tonight, but I want to thank you and all the persons at the hospital for the work of which they've done over the past 18 months during this pandemic, the preparation certainly, and now the work that certainly continues. Police Commissioner, pleasure to have you here this evening. Thank you. Minister of National Security, pleasure. And Minister of Health, thank you very much. To the sign language interpreters, so I'm sure we'll continue. Thank you very much. And to members of the media, thank you for your continued attendance and questions. Ms. Taiwan DeRosa, thank you as well, because I know that you continue to work day in and day out to make sure that you keep up with the epidemiology. And I look forward to watching you and the CMO and others by dealing with the particular technical matters so people can have a deeper insight to the technical items of which we are dealing with when it comes to pandemic. For all members of the public who are watching, I want to thank you for your attention and look forward to being back with you at some point in time in the future. As I said, if there are major policy announcements to be made, they will be made by members of the government, and we'll make sure that we are here to take questions on those policy decisions. But without that, I wanted to make sure that everyone has a wonderful and safe weekend. And please remember what the Minister of Health has said. Make sure that you go back to basics. Do what is necessary. Avoid close spaces, close contacts, close places. Make sure that you wear a mask, sanitize your hands, and keep your distance. So for everyone, for your attention, I want to say thank you again. And on behalf of the government of Bermuda, thank you for your continued work and cooperation. Thank you, Bermuda, and good